We all know where babies come from, but how do they work? Today, we will be exploring fetal and neonatal physiology in a series of questions that you can follow along with. The main questions we will be addressing is, how do important organ systems develop in fetal life? How does fetal metabolism work? How does neonatal nutrition work? What is prematurity and what are some associated concerns with it? And what kind of disorder is described in the given case study? First, we can begin with organ system development. So for the respiratory system, can respiration occur during fetal life? No, because there is no air for the fetus to breathe in the amniotic cavity. However, there are attempted respiratory movements in the beginning at the end of the first trimester. Also, inhibition of respiratory movements of a fetus are mainly inhibited in the last 3 or 4 months of pregnancy. How might this benefit the fetus? This inhibition during later months prevents fluids from filling up in the lungs and also debris from the GI tract into the amniotic fluid. So, how can the fluid be cleaned in the lungs? A small amount of fluid will be excreted into the lungs by the alveolar epithelium until birth. For the nervous system, what structure does the central nervous system start with? It starts with a neural groove that folds and forms into a neural tube. Gradually after, the spinal cord and brain will start to develop. And by day 28 after conception, the neural tube needs to close and fuse. What can occur if it doesn't? Neural tube defects or CNS birth defects can occur. Spina bifida is a more common condition that occurs when the bones of the spine fail to fuse. This can affect the nerves that spread from the area to the abdomen and legs. Spina bifida can occur anywhere along the length of the spine, but more commonly appears in the lower back. For the gastrointestinal tract, when does the fetus begin to ingest and absorb large amounts of amniotic fluid? By mid-pregnancy. And during the last 2 to 3 months, would GI functions be close to that of a normal neonate, meaning newborn? And yes, it would be. By this time, small quantities of meconium are formed in the GI tract and excreted from the anus into the amniotic fluid. Meconium are composed of amniotic fluid residue, mucus, epithelial cells, and other excretory products. And for the kidneys, when does the fetus kidneys begin to excrete urine? Second trimester is when the kidneys begin to excrete urine, and they make up about 70 to 80% of amniotic fluid. What could happen if the kidneys develop abnormally? There are a few things that could happen. There could be a reduction in amniotic fluid. Urine can go back up to the kidneys in a condition called hydronephrosis, which causes the kidney to appear enlarged on the ultrasound test and a blockage that may cause urine to back up into the kidney. It could also lead to fetal death.
Our next topic is going to be fetal metabolism. So the main question is, how does the fetus obtain energy? What happens is the fetus obtains glucose from the mother's blood, which is then metabolized into energy or synthesized into fats and proteins and later stored. The fetus also metabolizes calcium, phosphate, and iron. An average of 22.5 grams of calcium is used, mostly during late gestation. An average of 13.5 grams of phosphate is used during late gestation, and both the use of calcium and phosphate correspond to periods of rapid ossification and rapid weight gain in the fetus. Iron is used early on during fetal development to form hemoglobin. Fetal metabolism also requires vitamins. The main vitamins that are required are B vitamins such as B12 and folic acid, vitamin C, vitamin D, vitamin E, and vitamin K. B vitamins are mostly used for the formation of red blood cells and nervous tissue. Vitamin D is used for bone growth. Vitamin C is used to form intracellular substances like bone matrix and other connective tissues. Vitamin E is responsible for much of early embryonic growth. And vitamin K is involved in the formulation of various blood coagulation factors. All of these vitamins must be obtained from the mother's blood, so adequate maternal nutrition is necessary for optimal fetal development. How does this change when a baby is born and in the neonatal phase? So initially, a neonatal infant is unable to obtain energy from any external source. Since it's cut off from the mother's blood, an infant must utilize glucose, which has already been stored as fats and proteins, until 2 to 3 days later when milk is provided and the metabolism is very similar to an older child. But there are exceptions at this point. The first exception is liver function. Neonatal liver function is very low, leading to low and unstable blood glucose levels. The fat absorption of neonates is significantly lower. And there's a deficiency in pancreatic amylase secretion, which leads to inefficiencies in starch usage in neonates.
So now we're going to be talking about prematurity. So what is prematurity? Prematurity generally refers to when a baby is born before the 39 to 40 week average of pregnancy, and prematurity is the leading cause of newborn death. So for the terminology we're going to be using, full term refers to 39 to 49 weeks of pregnancy, preterm is 32 to 39, very preterm is 28 to 32, and extremely preterm is less than 28 weeks of pregnancy. What is prematurity and what contributes to it? So some symptoms of prematurity include a small size with a disproportionately large head, fine hair or lanugo covering much of the body, low body temperature and sharper looking features due to lack of fat storage, and lack of reflexes for swallowing and sucking, leading to feeding issues in the future. So what are the risk factors for prematurity? Some risk factors include having a previous premature birth from the mother, pregnancy with twins, in vitro fertilization, smoking cigarettes while pregnant, and chronic health issues including high blood pressure, diabetes. So what are some short-term issues? So some cognitive short-term issues include an immature brain that continues to develop after birth, and the more prematurely the baby is born, the more likely bleeding will affect brain function. Some respiratory concerns include serious breathing problems in preterm infants and can result in the use of a ventilator being needed. So what are some long-term complications of prematurity? Some complications include learning impairment due to a less degree of brain development, especially cerebral palsy due to inadequate blood flow or injury to a newborn's developing brain, sudden infant death syndrome or SIDS, and retinopathy of prematurity, which is caused by blood vessels in the back of the eye becoming swollen and can cause gradual retinal scarring.
So now let's look at a case study. So what disorder do you think this is? The patient, Lily, is a 3-year-old girl who was born premature at 28 weeks. She is experiencing the following symptoms, including stiff muscles, difficulty speaking, exaggerated reflexes, lack of balance and coordination, and intellectual disabilities. What disorder do you think this could be? So the disorder is cerebral palsy, and it is a congenital disorder of movement, muscle tone, or posture, and is due to abnormal brain development, often before birth. CP is the most common motor disability in childhood. Symptoms include exaggerated reflexes, floppy or rigid limbs, and involuntary motions, which appear by early childhood. And long-term treatment for cerebral palsy includes physical and other therapies, drugs, and sometimes surgery. So how does prematurity impact the chances of having cerebral palsy? There are several risk factors, including low birth weight, preterm delivery, and infection, but these are linked to cerebral palsy because of several reasons. So low birth weight is associated with underdevelopment at the time of birth. Because of this, cerebral palsy is linked with low birth weight because it is an indication that the brain may not be fully developed by the time of birth. A premature infant also may have
other body systems and nervous systems that may not be fully developed, which can cause complications such as breathing problems, making it difficult for oxygen to reach the brain, causing damage. Preterm delivery comes with risk of brain injury during delivery. Paraventricular leukomalacia is damage, which is damage to the brain's white matter. It is associated with cerebral palsy and also closely linked with preterm delivery. For infection, the mother's womb shields the fetus from infections and various abnormalities, and premature birth removes these protections, putting them at higher risk of infection that can damage their brain.
Thank you so much for listening in, and we hope you had a good time learning and following along. If you have any other questions, please let us know.